This time of year, allergies are driving everybody crazy, and the dry air can make our dry eyes more of a problem. Dr. Jeffrey Whitman of the Key-Whitman Eye Center joins me to talk about new treatments for dry eye. Good morning, and I want to tell you I love what you guys have done with my issue with dry eyes.
Well, we love treating dry eyes because it's a big problem.
Yeah, it really is. A lot of folks have it. So I could tell you, but why don't you listen to Dr. Whitman tell you, what do patients with dry eye experience?
Well, typically we see patients coming in with, my eyes are kind of gritty. It feels like there's something in them. Itchy eyes can be, can be confused with allergy eyes, and that can be a problem in figuring out what's going on. But stinging, burning, redness, and numbers of people will come in and say, Doc, when I blink my eyes, it's kind of like a dirty windshield wiper. It'll clear up, and then it'll get foggy, and that's because you're spreading around a gunky tear film, and it just isn't right.
Well, and speaking of tears, in my case, I would have, like a few months ago when Dr. Whitman was here, he noticed I would have like tears coming out of my eyes. I'm like, what's going on? So you've explained the 3 layers of tears being out of balance. Can you talk about that?
Well, we have tear film that protects the surface of our eye, the cornea. We have an inner layer, mucus layer that sits against and smooths the cornea out, a middle aqueous or watery layer, and an outer oil layer. And that really keeps the other 2 layers in balance and stops them from evaporating, going away. And any of these layers get out of balance, you're going to have symptoms of dry eye.
So is it primarily people at my stage of life who are affected?
Anyone of any age can have dry eye, but typically we see patients 50 years of age or older, more female than male, so there probably is some chemical hormonal influence. But certain drugs like antihistamines and antidepressants can cause dry eye. And what a lot of people don't know is chronic or long-term contact lens wear can also cause dry eye problems. And you can just imagine that can make wearing your lenses very uncomfortable.
Yeah. What if you have mild symptoms? What do you do?
Okay. Mild symptoms, typically the treatment's going to involve the use of artificial tears, gels, and ointments. And these aren't the drops you get just moseying down the grocery store aisle. We'll try to recommend a preparation that fits what's wrong with your tear film. And for our moderate dry eye patients, we'll recommend a nutraceutical like Hydro Eyes. And it's rich in omega-3s and other nutrients that help stabilize and support your tear film.
Okay, what if your dry eye symptoms are severe, or the symptoms don't improve with the treatments for less severe?
Less severe. Well, and these are people that really have a big problem, and it's been ongoing, and we'll use a lot of the other treatments as well. But the problem for them generally has to do with those oil glands we were talking about. They get stopped up, they lie on the edge of our eyelid, and they don't secrete anymore. And we have some really good treatments now, like IPL, intense pulse light therapy, LipiFlow, and we have other treatments that are geared towards opening those glands again by gently warming them up so they start flowing again and can, again, protect your tear film. That's so important. And these treatments can last upwards of 6 months.
Okay, the IPL is what I did, and you don't see me crying anymore. So, quick question, is it covered by insurance?
And by the way, I've had the IPL done too.
Okay.
I have dry eye, so it works. So, and painless.
I think
that's
no
important.
problem at all. Is it covered by insurance?
Good. But unfortunately, it's not covered by insurance, but we've really tried to make it affordable. And my patients that have had it done say the cost is well worth it for really reducing those symptoms.
Okay, well, I am going to give you the details. If you're like me or Dr. Whitman and have some symptoms of dry eye, the IPL laser is available only in Dallas and now North Arlington. Is that right?
That's correct.
Okay. Patients with dry eye symptoms need to call 214-220-3937 or visit keywhitman.com to get that appointment.